Hi, my name is Patricia. In today's presentation, I'll be guiding you through the different steps of the clinical decision-making process. This process is very important to us as massage therapists, as it enables us to provide the best possible care for our clients by helping us to select the best approaches to examination, plans of care, and treatments. The clinical decision-making process is a process by which therapists analyze client information and formulate and progress therapeutic regimens for their clients. This is one of our key functions as massage therapists. The clinical decision-making model is a 4-phase model. Each phase has its own purpose and procedures. The process is presented linearly here, but instead should be used as a repetitive process that serves to expand upon the therapist's information and refine their conclusions. This model can be used for both medical-based massage and wellness-based massage. When they are used skillfully, these phases enable the therapist to effectively match the client's presenting issues to the best suited treatment techniques. In the end, this will improve the quality of care that's being delivered, which in turn improves clients' outcomes and ultimately their satisfaction. Let's have a look at each phase in a little more detail. The evaluation phase is the foundation of our clinical process. The steps in this phase concern themselves with formulating and confirming a clinical hypothesis or establishing a client's wellness goals. This phase begins with data gathering through client examinations, both subjective and objective. Through this process, the therapist confirms their clinical hypothesis or confirms a diagnosis from a referring practitioner, creates a summary of their findings, and decides whether treatment should be pursued. The treatment planning phase begins with a summary of clinical findings from the evaluation phase. Body structures and functions are identified that are appropriate for treatment, and proper treatment techniques are selected that will produce improvements in these areas. The proper techniques will also improve the client's functional limitations and improve their overall wellness. From this information, the therapist generates a written plan of care, also known as a treatment plan. The treatment phase is an ongoing cycle of treatment, re-examination, and treatment progression that begins after the therapist completes the plan of care. Treatment technique selection should be based on the techniques that are likely to have a desired effect on the presenting issue. Informal re-examination can happen at any time during the treatments themselves, using palpation and the client's response to massage techniques as tools. A more formal re-examination is conducted once the therapist can expect a measurable clinical change, in other words, after a series of treatments is performed. Using this information, the therapist determines if the client is ready to progress the treatment or modify the plan of care. There is no clear end to the treatment phase, but a gradual ramping down of treatment leading to the discharge phase. The final phase is the discharge phase. This phase spans the period from the initiation of discharge planning to the actual discharge date. Discharge planning is variable and has many different factors to consider. Generally, the process begins as the client approaches 75% of their functional outcomes. During this phase, the activities that occur during treatment sessions shift in emphasis from the therapist delivering care to the client's performing self-care. Here, the therapist will identify the post-discharge needs of the client and puts place any referrals that are needed to other healthcare professionals or a program of home care that is necessary to support the client in the recovery process. Now, let's see what you've learned. In the next few slides, you'll be asked to answer some questions about the material that's been presented thus far. In which phase of the clinical decision-making model do you gather the client's information and data? Describe the other function of this phase. Mr. Smith came in to see you for his painful wrist. You've already asked him all the pertinent questioning and performed your selected tests and measures. From these results, you conclude he has carpal tunnel syndrome. Which phase of the clinical decision-making model are you ready to move into? After 4 treatments, you decide to formally re-examine Mr. Smith. You find his results to be improved from his initial testing. Which phase of the clinical decision-making model does this procedure fall within? Mr. Smith is very pleased with the results of your treatments for his injury and is having much less pain and increased function. What phase of the clinical decision-making process will you transition to? What would you do for Mr. Smith? Dig a little deeper to find out. What are the differences between wellness massage and medical massage? Find out the meaning of the following terms: clinical hypothesis, objective examination, subjective examination, functional limitation, functional outcome. Hopefully, you've learned about the different phases in the clinical decision-making process and what each phase involves. The next video in this series involves a more in-depth look at the first phase of this model, the evaluation phase.